Hi, my name is Eunice Gonzalez, and today I will be talking about what political and economic system I think is best for the United States to use in response to COVID-19. Before I begin, I wanted to give a brief overview of my presentation, just so we know where we're all headed and so you know how it's organized. First, I'm going to talk about my personal background and some of what my values are. Then I'm going to discuss what I believe are some of the most significant issues facing the United States because of COVID-19. And from there, I'm going to compare the United States' response versus that of other nations to COVID-19, as well as our economic systems. And finally, I'm going to give my recommendation and kind of the pros and cons and how I think that will play out. So first, just some context, I am a senior psychology student. I graduated in May and I'm trying to enter the job market. So number one, job security is super important to me. Secondly, my ultimate career goal is to become a school psychologist and help provide children with an equitable education. So equitable education is another big value for me. And finally, I have a health issue that requires daily medication. I have Hashimoto's. That means my thyroid doesn't function as well as most people. Um, so healthcare and prescriptions cost is another big thing that I'm really concerned about. And if you have any more questions about what it is that is important to me and where I kind of lie on the political spectrum and kind of just a sneak peek of what I think what my recommendation is going to be, you can go check out Bernie's political platform. So yeah. So to begin, one of the first big issues that I see in the United States is our unemployment rate right now. Not only the unemployment rate, but what that unemployment rate can mean. So as of right now, there are 16 million people who have filed for unemployment, and we aren't even close to stopping ours in California, our stay-at-home order. Unfortunately, in the United States, a loss of a job often means a loss of healthcare, and that it's really dangerous right now. Secondly, the impact of online education on low income inequality and how online education is kind of widening that gap in inequality. A lot of families don't have access to high speed internet, and if they do, it's through a phone, not a computer. So, making it really hard for children to gain access to education is one. Secondly, limited options for parents to work from home because there's the issue of childcare if you're an essential worker or if you can't afford to lose your job or can't afford to take paid sick leave. Thirdly, services provided by schools are no longer available. After school care is a big one, and also free snacks and meals. I mean, I remember just getting school lunch because it was easy and it was there. And it's like a lot of people who are food insecure. Luckily, I never was. Now no longer have that. So how are those parents going to pay for those meals now, right? And then finally, a lot of these children may be facing greater stressors. If their parent is an essential worker, worry that they're going to get infected. Financial insecurity is a big one if their parent loses their job. And finally, housing insecurity. Luckily in LA right now we have an eviction moratorium, but that doesn't mean that we stopped paying rent. So that's a big thing going on. And then finally, how the US healthcare system is making it harder for us to stop coronavirus. So, first, a shortage of primary care physicians and ICU equipment. That's a big one. Secondly, lack of paid sick leave compared to a lot of our counterparts if you're infected. What does that mean? How much paid sick leave are you allowed to take? And also how your company decides to pay you. Some companies are choosing to go on paid sick leave to allow their people to stay at home and social distance, but how long is that going to last if you already have um, a negligent amount of paid sick leave? And finally, lack of healthcare coverage combined with rising costs. So first, if you lose your job, you lose your healthcare coverage. That's unfortunately the reality in America. And also rising prescription costs. For me, I've seen my prescription costs rise from almost negligible to almost double. So that's also a big thing facing the United States right now. So how does the US's response compare to other countries? Well, we are all facing a shortage of ICU equipment and doctors and loss of employment. That's not anything specific to the United States. However, other nations of a similar economic size, so I'm just going to use Canada and the UK for the sake of this argument, are not facing a loss of healthcare along with loss of jobs, have more generous paid sick leave policies to begin with, and have more equitable relief packages. So, for example, in Canada, delay of student loan repayment. To even begin that, their student loans are significantly less than ours, and they are delaying their payment. Provide small businesses with a wage subsidiary for 3 months, meaning they can pay their employees and allow them to social distance. And finally, expanding child benefits program. You know, having get, in Canada, if you have a child, you can apply for this child benefits program, and the Canadian government can give you money to aid in raising and providing for that child. And now they are expanding that for families who are experiencing food insecurity or lack of childcare, etc. So, how do our economic systems compare? I think if I go back to the other slide, you can see that a lot of these policies we tend to associate a lot with socialist programs, and they are. But we are all the US, Canada, UK, and most nations, yes, even our favorite Scandinavian socialist ones, are a mixed economy. So what does that mean? It means it combines a different type of economic system between market, command, and traditional economies. In this case, socialist public programming with free trade. This means a mixed economy. The benefit is it allows the government to protect certain assets while allowing the free market and private entities to function as well. So for an example, in Canada, the government would probably protect healthcare and childcare in that regard, but allow private entities to function in terms of trade, in terms of other aspects of their economy. So my recommendation, I don't think you're surprised, is socialist public programs using that socialism philosophy that we learned about into our public programs. I don't think we need to rehaul the US economic system. As we've seen, there are mixed economies that operate like this, who are also mixed economies. We just need to be able to rethink about how we operate it. So currently in the US, a lower socioeconomic status indicates an increased difficulty with combating COVID-19. Why? If you're an essential worker and you can't social distance, you can get it. No job security, you lose your health care. A lot of families rely on food stamps or they can't access food because the places that they go to now are being swamped. You know, there are socialist public programs that can be put in place to kind of negate these issues and kind of allow people to properly social distance and in order to remain healthy. So given how other governments operate, there are ways for us to incorporate these ideals to ensure that our citizens can focus on protecting their health rather than possible debt or stressors. And kind of just a reminder that socialism rests on this idea that the government controls the means of production to distribute wealth to the workers of society. I'm not saying we go full socialism. I'm saying that in terms of our public programs, we should. Um, and that's kind of what a mixed economy is. It's kind of taking what you think is best from these different types of economic systems and melding them together. So what are the benefits of this approach? Well, first, a national public health care with private options, kind of like what Canada and the UK have. You have a base coverage that the government provides, but also private options that allows private healthcare companies to also exist. And it's not tied to an employment, thus ensuring coverage and treatment for all. Expanded paid sick allows for employees to social distance for longer, keeping them healthy and keeping others safe. And then finally, a child's benefit program allowing for a family to tackle food insecurity, afford childcare alternatives, stay at home, and like pay for internet access, pay for the things that their child needs in order to properly get the most out of their education. And I think that's what is kind of the benefits of this approach. At the end of the day, a lot of these experts are kind of recommending we need to social distance, but it's kind of hard when your choice is between social distancing and your job, aka healthcare coverage, or social distancing and putting meal on the table for your kids, you know. So with a socialist public program, that wouldn't be the case. So let's talk about execution. The ideals of socialism do seem like normative economics, but as we've seen them play out successfully in areas like Canada, the UK, and the EU, we can see that they can become more like positive economics. The primary method for this would obviously be fiscal policy, which would allow the government to tax income to pay for these initiatives. And we could cut from elsewhere. Right now the government is spending $8 billion on COVID-19 relief programs, but we're also spending about $5 billion on a space army. I think there are ways that we can have our cake and eat it too. And, according to some estimates, Medicare for all could result in $4,000 of savings per person for a year. So these socialist programs don't always have to come at a cost. You know, had these programs been in place, maybe we would not have to be spending so much on our relief package right now, which would then increase our taxes later on, you know? It could be half or maybe three-fourths of it. So that's my recommendation. And kind of these are my sources. So yeah, thank you for listening.